common signs and symptoms you might have of a stroke. A stroke, or cerebrovascular accident, CVA, is a scary experience. It occurs when the blood supply to the brain is impeded or cut off completely due to lack of blood flow, or ischemia, blockage, thrombosis, arterial embolism, or brain hemorrhage. As a result, the brain stops functioning normally and oftentimes the muscles in the body, the reflexes, and the senses are all affected. People often ignore the warning signs of stroke until the problem becomes severe. It is important to be aware of these signs, as addressing the problem early can save you from future complications. If you have multiple signs and symptoms of this problem, ask your doctor to check your health levels. And here are 7 common signs of a stroke that you should know. 1. Weakness in arm or leg. We already know that stroke usually affects only one side of the body, and often a weakness appears in the opposite side. This can be manifested as a weakness or numbness in the arm or leg, or even paralysis. There is an easy test to check if this is happening to you. Just extend your arms with palms up for 10 seconds. If one of your arms drifts downwards, it usually means you are having a stroke. Do this with your legs as well by lifting each of them separately with your eyes open. 2. Difficult speech. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. Difficult or slurred speech is another obvious warning sign. If an individual suddenly has difficulty speaking or forming intelligent sentences, it can indicate a stroke. Observers often explain it as watching someone helpless trying to talk, or a look of sudden confusion on the affected person's face. The person experiencing the stroke can feel extremely confused at the inability to speak, put words together in a sentence, or simply trying to focus on speaking. Speech can be greatly improved in the first few months following a stroke. The American Stroke Association identifies 3 speech disorders that can occur after a stroke: aphasia, difficulty or inability to use or comprehend words; apraxia, difficulty initiating or executing movement necessary to speak, despite being physically able to; and oral apraxia, difficulty moving the muscles of the lips, throat, soft palate and throat for things besides speech, like smiling. There are comprehensive treatments and therapies to help a stroke survivor regain their ability to speak well and normally. 3. Loss of balance. The onset of a stroke will cause extreme physical turmoil, so much so that often victims have trouble walking, lose their balance and coordination completely, and even have trouble sitting down without falling. You could stumble and it could feel next to impossible to get your balance, even just focusing on your balance and coordination. Dizziness, discussed in more detail further in this article, is a common symptom that goes along with balance, walking and coordination issues, because the dizzy feelings can actually sometimes be the cause. While loss of balance is a symptom of a stroke, you can also experience it after a stroke. You may continue to feel dizzy and insecure in your ability to walk without stumbling or falling. According to the Stroke Association, you are more likely to experience balance problems if the stroke affected the left side of your body. Some stroke survivors may only feel mild balance issues, while others may have severe loss of balance, impacting their quality of life. 4. Impaired vision. Those affected by a stroke often explain there is a period prior where they have trouble seeing or seeing clearly. They could experience double vision, blurred vision, or complete loss of vision. These vision problems might only be temporary, but observers can test visual aptitude by asking the victim how many fingers they are holding up. If they can't tell, call 911-1. Many people who have had a stroke experience vision problems afterwards, especially if the stroke was on the right side of the brain. You could have blind spots or trouble focusing because of the cells that are destroyed in the visual cortex. While a high amount of stroke survivors have impaired vision, medical advances have increased the chance of seeing well enough to do regular things like shopping, going out for a walk, or even driving. Intense treatment involving retraining the brain has helped many survivors get some or most of their vision back. 5. Facial paralysis. Oftentimes a stroke inflicts the facial muscles, where one side of the face droops or goes totally numb, so the face appears non-symmetrical when they try to talk or smile. This is a common symptom that's easy for other people to notice. When you suspect someone is having a stroke, you should ask the person to smile. This is a quick way to identify if they're having a stroke, and if facial paralysis occurs, get them emergency medical attention immediately. Even if the non-symmetrical smile or speech difficulty isn't from a stroke, it's still a sign that something serious is wrong. Rehabilitation therapy plays a crucial role in recovering from facial paralysis. Some stroke survivors fully recover from facial paralysis over time, but it is permanent for many people. This symptom and often permanent effect of a stroke is caused by either lack of oxygen to the facial nerve in the brain, or bleeding that puts pressure on nerves and tissues. 6. Loss of sensation. In the days leading up to a stroke, it's common for a gradual, or even a total, loss of vibratory sensation, or feeling, on the skin. Nerves in your brain send signals to different areas of your body. When you're having a stroke, these signals can be damaged or stop functioning properly, causing complete loss or reduced sensation. You could experience it in one or several areas of your body, depending on the affected nerves. The other senses such as smell, taste, and hearing can also be fully or partially affected. Unfortunately, stroke survivors can experience difficulties with sensation after a stroke, including hypersensitivity to touch, loss or reduced temperature sensation, not knowing where a limb is without looking, and reduced touch. It can be frustrating and upsetting to have temporary or permanent damage of this sense, and depending on the severity it may greatly impact your ability to do the normal, everyday things you did before the stroke. 7. Lack of reflex. It is also common to experience a decrease or loss of reflex. For instance, many stroke victims complain of trouble swallowing when eating to the point where they gag. The American Stroke Association says that up to 65% of people who have a stroke can develop dysphagia, a swallowing disorder. Since this is a predominant symptom and after effect of a stroke, it's always examined when you're in the hospital. There's a swallow test that can be done, and if you don't pass the test, a speech-language pathologist will be needed for rehabilitation. The temporary or permanent damage from a stroke varies from person to person, but one thing remains the same: the earlier you seek medical attention when you're having a stroke, the better your chances are at not just survival, but also full recovery. Knowing the warning signs and symptoms of stroke can help protect you and those around you. If there's even an inkling you or someone you're with is having a stroke, call 911 right away. Please note, the content provided below and elsewhere on this video is not intended, nor should it be construed as providing professional medical or nutritional advice. Do not rely on information provided on this video for your health problems. Instead, consult a qualified medical professional for advice. Top superfoods that can cut your risk of stroke. Stroke, also known as cerebrovascular accidents, is the medical condition caused by sudden cerebrovascular lesions. This condition can be caused by a blockage of blood vessels of the brain, cerebral infarction, halting the blood flow to the brain behind the obstruction, or due to the rupture of blood vessels in the brain, making the intravascular blood escape outside and spilling into the brain tissue, causing the tissue destruction and compression of the brain. Consequently, the relevant part of the brain which is wounded cannot work, resulting in part of the body which is controlled by that part of the brain cannot act. A well-planned diet can help prevent stroke. To treat your stroke, medications are needed. Medical treatment is a simple, safe and effective option. However, certain foods can also help reduce the risk of stroke and boost the effectiveness of your metabolism, so you can be away from stroke disease. Here's a list of some of the best foods and herbs to eat if your goal is to prevent and cure a stroke. 1. Ginkgo Biloba. Ginkgo Biloba is used to treat stroke. It aids to prevent the blood clots from growing and increases the bloodstream to the brain. The herb has been proven to inhibit the free radical formation. This herb is used widely in Europe in order to treat complications of stroke containing balance and memory problems, vertigo as well as disturbed thought processes. Many studies reveal that ginkgo increases bloodstream to the brain. Besides, ginkgo also aids to decrease fragility of capillaries. This helps prevent the hemorrhagic stroke. European physicians often recommend an extract of ginkgo leaves for the problems of stroke. More importantly, it is not toxic, so you should not worry when using it. You need to choose a product containing at least 24% of ginkgo heterosides and consume 40 to 80 milligrams 3 times a day. However, you also need to seek the medical advice before using it in case you are taking blood-thinning medication like aspirin. In excessive intake of ginkgo, you may experience irritability, diarrhea, and restlessness. 2. Turmeric. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. Research has shown that turmeric can help in regenerating brain cells, which helps in curing stroke. This is due to the wonder ingredient present in turmeric called curcumin. This compound helps in repairing damage caused by stroke. Therefore, stroke patients should include turmeric in the diet. Turmeric is a common spice used in Indian, Thai and Malaysian food. It is used to give color to curries, so you must have curry dishes. Turmeric is one of the home remedies on how to treat stroke that you and my other readers should know and make use of it for good. Many studies say that the compound curcumin containing in turmeric can reduce the formation of blood clots. Turmeric is a key ingredient in cooking and may be found in most of the curry spice blends. You should consider eating more curry dishes to reduce and even treat your stroke. Taking turmeric may help limit your risk for strokes by lowering your cholesterol, limiting any clogging of your arteries and thinning your blood. However, more studies using people are needed to verify that these effects happen in people as well as in animals. Turmeric may also help relax your blood vessels, which widens them and allows for blood to flow more easily, potentially lowering your blood pressure. 3. Ginger. You can also use ginger to prevent and cure stroke. It helps in reducing cholesterol and improving blood circulation. It functions as a tonic and gives strength to heart, and this improves the health of stroke patients. Ginger does not let the blood clot excessively, which helps in curing stroke. You should include ginger in the diet and add it while cooking food. Drinking ginger tea helps a lot. You can make this tea by steeping grated fresh ginger in boiling water. Take the drink when it becomes cold. Ginger is a cardiac tonic because it can treat stroke, decrease the cholesterol levels, aid poor circulation, and prevent blood clots excessively. Take 2 teaspoons of ginger daily for about 7 days can neutralize the blood clotting effects of 100 milligrams of butter. You can take advantage ginger in your cooking, or you can take ginger tea by using 1 to 2 teaspoons of fresh grated ginger root per cup of hot water. 4. Fish oil. Fish oil is also a great and nutritious natural ingredient that can help when it comes to tips and home remedies on how to treat stroke naturally at home. Omega-3 fatty acids have been proven to offer positive benefits, including treating stroke. Fish oil, especially from fatty fish like salmon, are very high in healthy fatty acids and have an ideal ratio of DHA, EPA and ALA. An alternative for vegetarian people is hemp seed oil, although it is more expensive. Fish oil benefits stroke people in 2 ways: by improving nervous system and mental health function, and by preventing coronary artery disease, thus following a stroke. It also aids to prevent other diseases related to blood vessels, which is important for people who have suffered a hemorrhagic stroke. Although there are some benefits of fish oil, it is worth warning that excessive amounts of this oil can contribute to the secondary stroke risk. In case you are unsure how much to consume, you should talk to your doctor or pharmacist.